So I wanted to talk a little bit about medical cannabis in Pennsylvania. Since 2019, we've been able to utilize medical cannabis for chronic pain. And it's been quite successful and quite helpful for many of our patients. Pennsylvania's been very progressive, along with many other states in the US. There are 32 other states that offer medical cannabis. And we've shown medically that it could be helpful in a variety of conditions. There are approximately 17 chronic medical conditions that one must qualify or have in order to be able to obtain medical cannabis and certification. Some of those diagnoses carry loose clinical interpretation, meaning you don't have to have a serious illness or condition to be able to qualify for medical cannabis. For instance, one of the conditions that's been mentioned is called neuropathy, and we can all suffer from neuropathy in one way or another. Carpal tunnel is an example of a neuropathy that one could technically qualify for use of medical cannabis in Pennsylvania. So it's really important, I think, for patients to be able to ask us without being too overwhelmed or being too discouraged by seeing one of the more serious medical diagnoses, because there are a lot of clinical interpretations that can be made by one of the physicians here at the practice, which may qualify a patient for certification for medical cannabis. We know scientifically that it can be useful for a variety of painful conditions. We've proven that in the lab, not only with animal models, but more recently with human models. It can be quite successful in alleviating chronic pain for a variety of reasons. It's interesting also scientifically because we've now determined that our bodies inherently have cannabis pain blocking receptors in ourselves. So we feel that from an evolutionary perspective, cannabis had been used in centuries ago, hundreds and thousands of years ago, in our predecessors quite successfully, because we carry a receptor to block pain that responds very well to the cannabis chemical. There are different varieties of medical cannabis that one can obtain, and we can review that with each patient. There tends to be a social stigma about the use of cannabis. Not all uses come in the form of being inhaled through smoke or cigarettes or vaporizing. Our providers will offer some insights as far as different varying resources and ways to be able to get that cannabis or products into your body to help with pain. For instance, there are tinctures, there's oils, there's droplets, there's sprays that someone could use orally to help them. There's also topical versions of cannabis that one could use over painful areas in the body. So I think it's really important to be able, again, to ask one of the providers here at the Pennsylvania Pain and Spine Institute about different sources and methods of obtaining medical cannabis. Quite simply, we would certify a patient. They would obtain a medical cannabis card within a week's time, typically from the state. There is an online format to apply, and once that's completed, our physicians here then certify a patient, and a card comes in the mail within the week. At that point, the patient is able to go up to a dispensary and meet with a professional at the dispensary to review their pain condition and select the appropriate products.